Hello. At one point, China was considered the source of a major health crisis. Today, a new mysterious virus is rapidly spreading between major cities and has become the talk of the world. What do we know about it so far? And could it evolve into a global threat? With the rise in the number of cases, questions are increasing. Are we on the brink of a new health crisis? What warnings should we consider? Stay with us in this video to discover all the details and be the first to know. 5 years after the COVID-19 pandemic, China is facing a new health challenge that carries an unexpected threat. While the world began to gradually recover from the previous pandemic's aftermath, the HMPV, human metapneumovirus, emerged, presenting a new test for the healthcare system. This virus is known as one of the respiratory diseases with symptoms similar to the flu, complicating diagnosis and heightening global concern. With the number of confirmed cases rising, this virus is proving to be a significant challenge for China's healthcare system. It requires a swift and coordinated response to combat its spread and ensure the safety of citizens. With the arrival of winter, China has witnessed a noticeable rise in respiratory illnesses, sparking widespread international concern. As temperatures drop, the chances of respiratory viruses spreading rapidly multiply, further complicating the health situation in the country. This sudden increase in cases may put additional pressure on hospitals and healthcare workers, adding to the challenges of dealing with emerging viruses like HMPV, at a time when the world is still grappling with the aftermath of the previous pandemic. While Chinese authorities are taking precautionary measures, the world remains on edge, closely monitoring the developments of this serious health situation, which amplifies the crisis on both local and global levels. Medical reports indicate a significant rise in HMPV infections, alongside the spread of several other viruses that pose an additional threat to the healthcare sector. While China's healthcare system faces major challenges due to this new virus, cases of other viruses such as influenza A, which causes severe respiratory symptoms, and Mycoplasma pneumoniae, which particularly affects children and the elderly, are on the rise. Some reports even indicate the emergence of new COVID-19 cases, which further complicates the health situation in the country. This is coupled with increasing pressure on hospitals, exacerbating the situation and heightening the concerns of both citizens and health authorities. Videos have spread on social media showing alarming scenes from overcrowded hospitals, where the number of patients has noticeably increased, putting immense pressure on the healthcare system. In these videos, citizens are seen wearing masks, a sight that brings to mind images from the previous COVID-19 pandemic. This scene evokes painful memories of the difficult times the world endured and heightens individuals' fears amid growing concerns over the spread of more respiratory illnesses. As the health situation continues to worsen, the question remains: how capable is China of facing this new challenge without resorting to the strict restrictions imposed at the peak of the previous pandemic? The spread of the HMPV virus is also characterized by unprecedented complexity, as the healthcare system faces a real challenge with multiple respiratory viruses spreading simultaneously. The large number of viruses in circulation makes quick and accurate diagnosis extremely difficult, complicating doctors' ability to identify the virus responsible for the symptoms and further complicating treatment options. The HMPV virus includes a range of bothersome respiratory symptoms such as fever, cough, nasal congestion, and shortness of breath, which may resemble symptoms of several other viruses like the flu and mycoplasma. In severe cases, the infection can develop into bronchitis or pneumonia, posing a greater risk to vulnerable groups such as children and the elderly. The overwhelming number of cases reflects the scale of the health crisis facing the medical sector in China, requiring a swift and coordinated response to effectively combat the spread of these viruses. China's and the international community's reactions. Despite the growing health challenges, Chinese authorities have sought to calm the situation by downplaying concerns about the current state of affairs. A spokesperson for the Ministry of Foreign Affairs, Mao Ning, stated that respiratory illnesses typically peak during the winter season, noting that the spread of viruses during this time is common due to weather changes. She explained that the current outbreak is less severe compared to last year, in an attempt to reassure citizens and the world. However, concerns remain due to the immense pressure on the healthcare sector, and China's ability to control the situation continues to be closely watched by all. The Chinese official pointed out that the country is following strict guidelines to prevent respiratory diseases, with preventive measures including enhancing health protocols in public places and medical facilities, as well as continuous monitoring of the situation to ensure the safety of citizens and visitors. She emphasized that the authorities are making significant efforts to combat the spread of respiratory viruses at present. While China denied the existence of a major health crisis, stressing that the situation is under control and does not warrant excessive concern, they also confirmed that travel to China is safe, with all necessary measures taken to protect travelers and residents. The World Health Organization, WHO, stated that it is closely monitoring the situation and tracking the developments in China's health status. However, it confirmed that it has not yet declared a global health emergency, indicating that the health crisis remains in a manageable and controllable phase. In India, the Ministry of Health confirmed that the country did not report any unusual increase in respiratory illnesses during December 2024, suggesting that the health situation remains stable so far. The ministry clarified that health systems are working to ensure hospitals are prepared for any potential seasonal increases in respiratory cases by providing necessary resources and trained medical staff. They also emphasized that health authorities are closely monitoring the situation and that preventive measures continue to ensure the safety of citizens and residents. Indian authorities have advised citizens to follow simple preventive measures to reduce the spread of respiratory diseases, such as avoiding direct contact with others when respiratory symptoms like coughing or sneezing appear. They also stressed the importance of regular hand washing and wearing masks in public places when necessary, especially when feeling unwell. The authorities added that these preventive measures are essential to reduce the risk of respiratory viral infections and to maintain overall community health. They also emphasized the need to consult doctors if severe or unusual symptoms arise. It is worth noting that the HMPV, human metapneumovirus, was first discovered in 2001 and belongs to the pneumovirus family, which also includes the respiratory syncytial virus, RSV. HMPV is a respiratory virus that affects the respiratory system and can cause symptoms similar to the flu, such as coughing, fever, and nasal congestion. The virus is primarily transmitted through the air via respiratory droplets produced by coughing or sneezing. It can also spread through contact with contaminated surfaces. The virus is known for its ability to remain active on surfaces for extended periods, increasing the likelihood of transmission in public and crowded spaces. This necessitates the implementation of effective precautionary measures to prevent its spread.